Thank you, Glenn.
Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Talk about Moderna and this new vaccine, how it's different.
Okay. So Moderna, number two, it was developed in Cambridge, Massachusetts, and with significant help from the NIH. So it's a U.S.-based vaccine product. Messenger RNA, same mechanism as the Pfizer. A little piece of protein goes in there, tells your cells to make this spike protein. So it's not actually a live virus. Body makes a big immune response to it, and it works great. 94% efficacy overall. However, there's a little difference here. In people over 65 who typically don't respond as well to vaccines, it does drop down to 86%. Now, that's not too much, but they didn't see that impact on age in the Pfizer vaccine group.
Let's talk about the post-Thanksgiving surge. We were expecting these numbers to go way up in Illinois, but it's kind of a mixed bag. Talk about that.
Robin, it's a very mixed bag. It didn't go as we were predicting. However, it's not a good sign because a lot of people did postpone their activities at Thanksgiving. So there was some kind of behavioral effect. The cases did not surge like we expected, although, maybe we'll see that a little later. But what's happened, though, is the hospital rate and the ICU rate did go up. So people are sicker. It's very strange. It'll play out in the next week or so, but it is not as bad as we thought. Let's put it that way.
But this does not mean, does this make people optimistic about getting together for Christmas then?
That's actually a really good question. If they do exactly what they did at Thanksgiving, probably the same thing is going to happen. So, a lot of people curtailed their Thanksgiving activities. So, that behavioral action may have been enough to sort of blunt this bump up that we were expecting. So if they just go back to the way it usually is, yeah, you're going to see an increase. So you have to be very, very careful here.
Talk about the changes in the travel order and this now reduction to a 10-day quarantine. Is that based on science, or is that just a politician saying, well, they're not going to obey 14, maybe they'll obey 10?
No, this is the doctors coming up with some scientific advice. It turns out, so the coronavirus affects you, and it's up in the upper part of your head, in your nose, in your throat, in your mouth. And after 10 days, it's hard to culture the virus, a living virus. Now, those PCR tests can always find some particles, but that doesn't count. If you look at the live virus, you don't find it. And that's where the 10 days comes in. After 10 days, it's very hard to find. And some people, 85% of people are going to go just get better, never go in the hospital. The ones in the hospital, it goes down in the lungs and causes all sorts of damage.
You're looking for patients affected by COVID-19 for your study?
Yeah, this is part of RADx, the Rapid Acceleration of Diagnostics for Coronavirus. We're testing a really simple rapid test, takes 15 minutes, but we compare it to the standard PCR test, the one you have to wait in line to get and take 3 days to get the results. That is the best test. So we are looking for people who think they have COVID, or somebody in their household, or somebody they work with, somebody they're close to has recently been diagnosed with COVID. And we're happy to test them for free.
All right, first viewer question. Dr. Murphy, will you be taking the vaccine now that it is available to you?
I will take the vaccine as soon as they let me take the vaccine. At the hospitals, we've had to sign up. You have to, on the survey you fill out, you have to put, are you working closely with COVID patients, which I am. And then, do you have any risk factors, which I have because I'm old. So I get high risk frontline worker status, but I have not been selected yet. There have been 2 people in my department who've been selected. So it's going to be a much slower rollout. It doesn't happen overnight. They can't vaccinate every person on the same day. So I'm waiting, and I'm going to take it, and I'm taking the Pfizer one.
All right. The Chicago Tribune is reporting that incidents of flu are way down. Isn't this because everything is being classified as COVID?
This is a real misnomer. This is not true. That is COVID is being misdiagnosed. Flu is way down. Why is it way down? Because we're not socializing nearly as much. We're wearing masks. Many people are wearing masks all the time. and we're keeping further apart from each other. So flu is way off. This is just the beginning of the flu season. So, but it's way down. However, the hospitals are full. COVID's being diagnosed like crazy. It's not difficult to make the diagnosis of flu or COVID. So that whole thing about, this is all just flu is ridiculous.
All right.
It's COVID.
All right, one more question. My 80-year-old mother lives in an assisted living facility. She has had COVID, was asymptomatic. Should my mom get the vaccine even though she has the antibodies?
Right now, no. Let her just rest and stay in peace there and not aggravate her. She's got antibodies. She had the disease already. We know very few people get the disease a second time, even elderly people. So she should just hold on. She doesn't need it. And then what happens, we're looking at these people very closely. That recommendation may change. But right now, she doesn't need it. And there's a lot of people that really need it.
All right, Dr. Murphy, thanks for being with us. You can go to our Morning News Facebook page and post a question for him there. We'll talk to him tomorrow at this time. Have a good day.
Have a great day.
Thanks, doctor.
Hey, Paulie.
Yeah, good morning. We're looking at cloudy skies.